a survey of patients from the UK, Italy, Sweden, and Germany looked at the overwhelmingly positive feedback for those who actually engaged in digital health tech during COVID-19. This is a big opportunity, and results showed that 49.3% of patients noted a significantly more positive experience with their healthcare provider. Only 40% had a neutral experience, and only 10% had a negative experience. So during the pandemic, a lot more people were interacting with digital software. Research has suggested that I think this was a survey conducted over 6,326 patients, and looked at how much of a positive impact that actually had on patients. So patients seem to be demanding, and they want more tech in the process. Those who had the negative experience, so you always need to be careful in this scenario as well. And one big thing that we pay a lot of close attention to is the capability to access software as well. So you need to be very careful when you're creating software and you're saying this is the only way of doing things. Some people might not be capable, or they might not have the devices as well to access that software. So some people might have difficulties using software, and you always need to take that into account. Also, some people noted, those 10% with the negative experience noted that there was a lack of purpose-built regulated software options, and also a lack of interest in digital technology amongst older age groups. But one other area we focus on as a business in terms of digital adoption is e-commerce, and a lot of people were forced into buying things from home, and what we saw with particularly older age groups as well was that the digital adoption rates were much higher. So older people are getting much more comfortable in using day-to-day technology, but it also doesn't remove the reason behind having alternative methods as well for people